All right, so this is a model that's showing us the different blood vessels, systemic and pulmonary circulation that we need to know. And we always start from the heart. And I'm going to do the arteries first and then the veins. So always start from here. This is the ascending aorta. It's going up. And this is the aortic arch or the transverse aorta. And this is the descending one. 1, 2, 3. Ascending, transverse or arch, descending. Then the right side is different than the left side. And the right side, this right here, this is called the brachiocephalic trunk. Brachiocephalic trunk on the right side only is going to split into this, which is the right common carotid, and this, which is the right subclavian. On the left side, it's different. On the left side, you see this, which is the left common carotid coming directly from the aortic arch, while this and this, which is the left subclavian, also coming directly from the aortic arch. So remember, in the right side only, I have a brachiocephalic trunk. This is in the arteries. Brachiocephalic trunk, just this little piece here, and until it splits. Remember always that when you see a blood vessel splitting, most of the time it changed the name. So this is brachiocephalic trunk, right common carotid, right subclavian. Left side, left common carotid, left subclavian. If you continue with the common carotid, it's going to split into internal and external. This is called the facial, and then it will continue as an external, and the internal will goes in probably this one right here. So external and internal, and this is as far as we need to know. Other than that, if you follow with this, which is the subclavian, this is easy because if you go with it like this, subclavian is under the clavicle, and the clavicle should be here, so it's called the subclavian, until you go to the axilla, which is the armpit. At this point, you call it the axillary artery until it splits. When it splits, it gives you this one and this. This is called deep brachial, and this is called brachial. Brachial because it's inside, beside the brachium. Brachium means this, the arm or the humerus. So you call it brachial, brachial, brachial until it splits. When it splits, there are other arteries, but these are the most important ones. When it splits, one of them will become beside the radius, you call it the radial artery, and the other one is beside the ulna, which is called the ulnar. How to know the ulnar from radial? Ulna from radius. The radius is toward your thumb, and the ulna is toward your little finger. So this is a radial, and this is where you feel the pulse, right here, in the radial one. At the end, you will see an arch here, an arch in the palm. We call it the palmar arch, and then you see arteries in between the digits. We call it the digital arteries. So this is for the arteries on this part. The rest of the arteries after the descending aorta, behind the heart, you don't see it, but it's called the descending thoracic aorta. And then it will appear after it get out of the diaphragm. You call it the descending abdominal aorta. The descending abdominal aorta is going to end up splitting into two final branches, right common iliac and left common iliac. Common iliac will continue here until it splits. External iliac and internal iliac. Same thing for the left. So internal iliac, you see this little part only. But the external iliac will follow until it split into three. 1, 2, 3. Femoral, deep femoral, circumflex femoral. Femoral, deep femoral, circumflex femoral. If you follow the femoral, remember that the name always makes sense. Here it's called iliac because this is the iliac region. Here you call it femoral because this is the femur, which is the thigh. So if you follow the femoral, which is beside the femur, all the way until this area here. This is the back of your knee, which is the popliteal fossa. So at this point, this part here, we are going to call it the popliteal artery. It's not different. It's the same as the femoral artery, but in the popliteal area, we call it the popliteal. And then at the end, it will split into tibial, anterior tibial, posterior tibial, and fibular, but we don't see it at this point. And then it will continue down, and you see this. This is the dorsal arch, digital arteries, but the left side is showing you something different here. This is the anterior tibial. It will continue here in the back or the dorsum of the foot, and we call it dorsalis pedis. Dorsalis, dorsal, pedis means foot, in the dorsum of the foot, right here. So this is for the arteries. If we go back here to the heart, and you see the venous part. The venous part, this is superior vena cava, that's bringing bringing back the deoxygenated blood to the heart, to the right atrium. And this is the inferior vena cava, same thing, but bringing the deoxygenated blood from the lower part of the body. The superior vena cava is bringing the deoxygenated blood from the upper part of the body. The branches that we need to know are, this is superior vena cava until it splits. When it splits, this part right here, just this little part, this is called the right brachiocephalic vein. This long one here is the left brachiocephalic vein. You can easily see the whole left brachiocephalic vein, but the right is short, just this little piece here. As soon as it splits, you have another name. This one here is the right internal jugular, and this is the right subclavian. On the left side, this is the left brachiocephalic vein, same thing, left internal jugular, left subclavian. If you follow this subclavian, it will give you that the vein that you don't see it in the arterial part, and this is called cephalic vein. Other than that, it will continue down like this, and here it's in armpit, so you call it the axillary vein. And then it will give you those two. This one here is the brachial, and this one here is called basilic. So this is different than the arteries. The basilic is the one that follow the brachial artery. So basilic, and if you follow it down, it will continue. You see this one going obliquely, that's connecting those two veins, cephalic and basilic, and this is called the MCV, or median cubital vein. It will continue down, you call it radial and ulnar, and the rest, the palmar arch, and so on. If you follow the lower part, which is, this is the inferior vena cava, from the inferior vena cava, you see veins going to different organs. It have the same name, like renal veins, suprarenal vein, and so on. But this is the inferior vena cava until this point, until it splits. When it splits, it's the same name as the arteries. So this is right common iliac vein, left common iliac vein. Each one of those common will split into internal and external. So this is the right external iliac vein, and this is the right internal iliac vein. For the external, this is the one that we can follow down, and it will give you that different vein, the huge, the longest vein in the body, which is called the great saphenous vein. Great, huge, great saphenous vein. Other than that, you still have the femoral, deep femoral, circumflex femoral, just like the arteries. And if you follow down, it will go, you still call it the femoral, and it will go all the way. You don't see a good part of it until you see it here at the dorsal palmar arch, venous arch, right here. So this is for the venous side. The last part here is this, which is the pulmonary trunk. Sometimes you call it pulmonary artery, but it's more commonly known as pulmonary trunk, that will split into this, which is the right pulmonary artery, left pulmonary artery, right pulmonary artery go to the right lung, left pulmonary artery go to the left lung. So remember, and if you look at the red here, this is inside the lung. Remember the rule, any vessel that's red is artery, any vessel that's blue except inside the lung. So this blue inside the lung is actually an artery, and this red inside the lung is actually the vein. So this is the pulmonary vein, and these are the pulmonary arteries, and that's it.